A very good morning to all. I am Dr. Uthra Mohan from IIP Digital Media team. I'll be host for today's webinar session. The topic for this webinar is stress management strategies in fibromyalgia, a treatment of choice. The resource person is Dr. Maithili Deshpande. This webinar is being organized by IIP Women's Health Thane District, Maharashtra. The moderators are Dr. Jayaganda, Dr. Dipali, and Dr. Ketki. This webinar is live on IIP India YouTube channel. I request all to subscribe to the YouTube channel to get regular notification during live webinars. You can also view the previous webinars in the playlist section where it is segregated as per each subject. Also, we would like to tell you about the IIP Digital Media team. We are a group of physiotherapists under IAP who handle the Zoom platform, live streaming, and IAP social media profiles. You can follow updates of upcoming events through the social media platform Facebook, Instagram, Twitter, LinkedIn, and YouTube. I'll be sharing the links for these profiles in the chat shortly. So now I request the Thane team to please take over.
A very good morning to one and all. Myself, Dr. Dipali Rathod, Thane District Sub-Coordinator for IPWC, Maharashtra, takes great pleasure to welcome you all for today's webinar. To begin with the introduction on IAP Women's Cell. IAP Women's Cell functions under the guidance of National Head Dr. Ruchi Varshme and IAP President Dr. Sanjeev Jha. We have 5 zones in India with heads for each. Dr. Pooja Kamble is the West Zone Head. The state team of IPWC Maharashtra includes State Coordinator Dr. Suvarna Ganvi, Joint Coordinator Dr. Snehal Patel, and Sub-Coordinators Dr. Uttara Mohan, Dr. Priya Pawar, and Dr. Nirali Sangri. We have 22 district committees in the state. In Maharashtra, IIP Women's Cell has conducted many low-cost activities like CMEs, workshops, conferences, webinars, public awareness campaigns, health camps, blood donation camps in various districts since 2018. In the years 2019, 2021, 22, 23, and 2024, IIP Women's Cell Maharashtra has received award for Best IIP Women's Cell State Team. Today's webinar on stress management strategies in fibromyalgia, the treatment of choice, with a resource person, Dr. Maithili Deshpande, is being conducted by IIP Women's Cell, Thane District. Dr. Jayaganda Rathod is a Thane District Coordinator. Myself, Dr. Dipali Rathod, and Dr. Ketki Bhosle are the district sub-coordinators. It's my honor to introduce our resource person for today's webinar, Dr. Maithili Deshpande. She is a PhD scholar, assistant professor in the Department of Musculoskeletal Physiotherapy in Ravi Nair Physiotherapy College, Savangi, Wardha. She is also IIP Women's Cell sub-coordinator for Wardha district. Before we begin, a quick note on the format. Our speaker will be presenting for about 45 minutes, followed by a question and answer session. So feel free to drop your questions in the chat at any time. Now, without further ado, let's give a warm virtual welcome to Dr. Maithili Deshpande. Over to you, Dr. Maithili.
Thank you so much, Dipali ma'am, for this introduction and for giving me the opportunity to present in this platform. Can I share
Your
my
voice is not audible.
Hello? Is it audible, ma'am?
No, ma'am.
Now is it audible?
Yeah.
Shall I share my screen?
Could you please raise the volume?
Am I audible now? Hello?
Yes, ma'am, you are audible.
Audible? Thank you, ma'am. Thank you so much.
Yes.
I will share the screen.
Yes.
So thank you so much, Deepali ma'am, and thank you, Thane District, for inviting me for such a webinar. And thank you so much for giving me this opportunity to present in such a esteemed platform. So we'll start with the webinar. So my topic for the webinar is stress management strategies in fibromyalgia, a treatment of choice. Many of you have seen the patients of fibromyalgia and many electrotherapy modalities as well as many manual therapy techniques have been practiced for to relieve the pain from fibromyalgia. But now in this session, we are going to see how the stress will be managed in fibromyalgia. As stress is a major factor, we can say that for the development of fibromyalgia. So how to manage this stress and what are the different strategies to manage the stress we are going to see in this webinar. So, fibromyalgia, it is a chronic condition which causes a widespread pain, fatigue, sleep disturbances, cognitive problems. There is a trigger point, the patient complains of overall pain in the body. So, basically, the fibromyalgia works on the hypothesis of central sensitization phenomena. So, I will give you a brief about the central, what is the central sensitization phenomena. Actually, central sensitization phenomena is when the central nervous system, especially brain and spinal cord, become hypersensitive to pain. So the normal pain get converted into the painful stimuli, and because of which it can lead to this widespread pain, fatigue, sleep disturbances, cognitive problems, tender points, trigger points. When the patient comes to OPD with the fibromyalgia, the patient mostly comes with the complaint of pain and in the overall body, or there will be a trigger points from at least of minimum of 11 and maximum of 18 trigger points according to the American College of Rheumatology classification 2017. So, in the fibromyalgia, there is a high prevalence of stress in Indian population, and that is 82.5% of patients which suffers fibromyalgia. The main factor is stress. So, to manage the stress, it is a very important factor in fibromyalgia. If the primary focus of the treatment is on fibromyalgia, then automatically on stress, then automatically the symptoms of fibromyalgia get vanished. So, first we understand what is stress. So basically, if we have to define the stress, so basically stress it is an reaction to any kind of stimuli or reaction to any kind of action, we can say. So basically, there are four responses for the stress. First is the physical response. Second one is emotional response. Third one is external demand, and fourth one is internal factors. So we go in detail about all the four factors. So first is physical response. When we have to face, when our body reacts to some stressful events, so there is some physiological changes which are happening inside the body. We can say that there is an increase in heart rate, or there is an increase in heartbeat. So these are all the physiological changes which are happening inside the body, which comes under the physical response. Second one is that is the emotional response. So basically, the emotions are the feelings and the emotions which are triggered by stress. Maybe in some stress we cry, in some stress we keep silence. So these are all the emotional responses which are given when the patient is suffering from stress. Third one is the external demand. So basically, external demand, that is the factors which are originating from outside environment, that is workplace stress or domestic stress. So these are all comes under the external factors. And internal factor is we can say that the which are arising from the personal thoughts or beliefs, that is fear, anxiety, happiness, depression. These are all the internal factors. So basically, these four factors combined, we can say that this is the stress, and our body will respond in that four different types to particular type of stress. So stress, it is good or it is bad. Actually, we can say there are two types of stress. One is positive stress, and second one is the negative stress. Or we can say their stress can be distress as well as eustress. So positive stress, sometimes it is the events that gives the pleasure, that is like marriage, getting a new job or better job, winning a match, good results, or becoming a parent proved to be stressful due to increased pressure, but it gives a feeling of positive vibe. So we can consider this stress as a positive stress. On the other aspect, there is a negative situations like illness, death, difficulty at the workplace, low income. These are all associated with the negative feelings. So these are come under the negative stress. you can say there are the another name for positive and negative stress, that's a eustress and distress. So eustress is the positive stress and distress it comes from the negative stress or negative situation. So there is some stress needed for human body to live healthy. So if there are no stress, that means total freedom from stress is death. So stress is necessary for the normal individuals. So there are some factors which produces the stress. So basically, what are the stressors? Stressors are the pressure which induce the stress. So basically, there are various type of factors which produces or induce the stress. So first is the domestic stressors. So we can say domestic stressors is most of the person's interaction with the family member is sometimes stressful. So these all that is marriage, divorce, unfaithfulness, unstable relationship, that all comes under the domestic stress. So in the children, if the children is sick with the permanent impairment, handicapped child, or poor academic performance, that all things come under the domestic stress. So second one is the occupational stress. So most of our time we spend at the workplace. So 8 to 9 hours we work for in a day. So most of the time are spent on the workplace. So there, if work dissatisfaction or low salary, unclear goal, office politics, these all create some kind of stress which comes under the factor that is called as occupational stresses. So there is another type called as a psychological stresses. Because of that occupational stress as well as with the domestic stress, there is another factor called as the psychological stress, that is office politics, isolated environment, rude people. So these are all considered under the psychological stresses. So basically, if you can say that in the psychological stresses, the counseling sessions will be beneficial for the patients to cope up with the stress and they can have a healthy and good life ahead. So as we have seen previously, there are some stress triggers and the responses to particular type of stress. So basically, the stress, it is a core reaction to any kind of change. So it may be positive or it may be negative. So there are responses based on this reaction to that stress. So first is the emotional response, which are the feeling of fear or excitement. There is a physical response, which are the body's reaction to stress. That means there is some physical changes which are happening inside the body. There are some internal triggers also which comes from the hopes, fears, beliefs, and the external triggers which situation which causes stress. So these are all four factors are responsible for the stress, and how our body react to that particular stress. It depends upon these four factors. So how the our body responds to stress and what health issues can be happen from this stress. There are basically four general reactions to stress. So first is normal. When the when there is any kind of stress, our body's defensive mechanism will act. That is a normal reaction to particular stress. Second one is neurotics, third one is psychotics, and fourth one is psychosomatic. So these are all four types of stress responses which are there, which we give that is the general response for the stress. So maybe sometimes that alarm which body gives, that is misinterpret. Then in the psychosomatic, actually the intensity of stress is so high, that means that all the stress are shifted towards the other body parts. So if the patient is undergoing by the stress, the patient may have the other complaints as well, like pain in the back, pain in the neck, or any other issues related to health. So these are all four reactions which our body gives to that particular stress. So there are some health issues also which we have to face during the stressful situation. So mostly the cardiovascular issues like heart attacks, angina pectoris. These are the most commonest issues which we faced during the stressful situation. So digestive and immunological issues as well. There is irritable bowel syndrome, cold, cough, depression. These are all comes under the digestive and immune issues. Then there is a neurological issues as well, that is migraine, so tension, headache, chronic fatigue. So when the patient is in state of migraine, the muscles get strained or fatigued due to the stress. So because of it, the patient is having the migraine attacks or migraine headache. So there is another term called as tension headaches or cervicogenic headache. These are all diseases which are their health issues which can be lead because of the stress. So how to cope up with this stress? So there are basically what is coping with the stress means how we can adapt to that particular stress at the manageable level, and how we change ourselves to that particular situation. This is the coping of stress. So basically there are main two methods for coping of stress. First is positive coping method and another one is the negative coping method. So basically if we have to describe what is positive and negative coping method, so basically, the negative coping method is unhealthy habits which increases stress level, like smoking cigarette or drinking alcohol. So drinking alcohol is a negative coping method, and smoking is also a negative coping method because it gives the adverse effect on your body. So likewise, there is a positive coping method as well. That is health habits that reduces stress level. So if we give the nutritious diet to that particular person, if the environment is healthy, if the patient is patient is doing yoga exercises, meditations, or breathing exercises. So these are all the positive coping methods which the patients can practice daily to reduce his stress level. So other coping methods are nutrition, relationship, exercises, diversions, or removal of the stressors from the life. These are all comes under the coping methods which we can see in further slides. So first is mastering breathing for stress relief. So if we can see, there are basically two types of breathing. One is chest breathing, another one is the abdominal breathing. So mostly the chest breathing is shallow and unsteady. So if the patient is in state of shock or is the state of stress, so basically this unsteady, the patient is in unsteady breathing. So if we have to relax the patient, then the unsteady breathing should be changed to the steady breathing or stable breathing. So basically, the chest breathing means the if the patient is having the more anxiety, more stress to that particular situation. And the abdominal breathing is when the abdominal, as we all know, the diaphragm is the abdominal muscles which are helping the breathing during the breathing. So mostly when the muscles got relaxed, eventually the patient also feels the relaxed position or in the relaxed state. So we can say it is automatic and usually involuntary, but also it is a unique that it can be controlled by deliberated effect. So if we practice daily about the breathing exercises, so automatically it gives a positive response to that particular situation. And of course, it is involuntary and it is automatic. So it can affect our emotions and physical feeling. Thus, proper breathing habits are essential for good mental and physical health. So if we master the breathing exercises, so there will be a good good mental as well as the physical health. So the issues which are happening from the physical health, that can be reduced because of the breathing practices. So breathing exercises can help in reducing anxiety, depression, irritability, muscle tension, as well as fatigue. So breathing exercises can be learned in a matter of minutes, and some immediate benefits are also there. But its profounder effect may not be fully apparent until months of persistent practice have passed. So we have to practice these breathing exercises for months, for years, or for days, so that we get mastered in the breathing, and we can cope up with the stress by the help of the breathing exercises. So there are basically three pathways to relaxation. So as we know, the relaxation is the best way to reduce the stress. So there are the major three factors for the effective relaxation. So first is the meditation. So meditation basically focuses on mind to achieve inner peace and relaxation. While there is a second method is called as progressive relaxation, which relieves the tension by tensing and relaxing the muscles group. So whatever the muscles are there in the cervical region, in the back region, because of the practice, because of the progressive relaxation practices or relaxation techniques, so it gets relieved and the patient automatically get reduced of pain. So there are the various techniques how for the progressive relaxation, which I will explain in further slides. Third technique is called as autogenic drainage. So autogenic drainage, it is a self-suggestion to induce relaxation and calmness. So basically, autogenic training, it is carried out in the four sessions. So I will explain that four sessions. So first we go for the progressive relaxation technique. So you can say relaxation means rest after the efforts, or more truly conscious rest after the conscious effort. So there are the three major current relaxation practices which practice daily, and you can say that this is practicing since 2010. So that is meditation, progressive relaxation, and autogenic technique. So what are the techniques come under the progressive relaxation? So for the step for the fist. So make the patient in the comfortable position. Make sure that patient is relaxed and totally comfortable. Tell the patient for make a fist and tighten the fist as much as you can so that he can feel the tension in the wrist and forearm muscles. And after some period of time, eventually tell the patient to relax so patient can feel the relaxation or feel the loosening in the fist and compare it with the previous one. So these are for the fist techniques. So you can first try for the left side, then go for right side, and then come simultaneously for both the fist. So step two is for elbow. So make the patient in the sitting position, in the comfortable sitting position. Tell the patient to flex the elbow and tighten the biceps muscle as much as he can, so that he can feel the tension in the biceps muscle as well as the forearm muscles. Then tell the patient to eventually relax within some span of time, so can patient can feel the relaxation or easiness in the biceps muscle. So step three is for the forehead muscles. Tell the patient to clench his forehead as much as he can with the eyes closed, and after eventually some in the duration of time, tell the patient to relax so the patient can feel the relaxation in the forehead muscles as well as in the facial muscles. Step 4 is for jaw. Tell the patient to clench the teeth as much as he can so that he can feel the pressure over the teeth region and the jaw region, and eventually tell the patient to relax. So after some period of time, the patient can feel the relaxation in the jaw region. Step 5 is for neck. So tell the patient to lean backward as much as he can in the comfortable position, in the painless position, and tell the patient to eventually relax in the neutral position, and the patient can feel the relaxation in his back region or in the cervical region. So step 6 is basically for the shoulder region. So tell the patient to shrug the shoulder with the back muscles in the tightening position, and tell the patient to shrug the shoulder as much as he can so that he can feel the stretching, or he can feel the tightness in the shoulder muscles, in the trapezius, upper fiber, lower fiber, or middle fiber, in the levator scapulae muscle, and eventually tell the patient to keep in the relaxed position. After some period of time, the patient can feel the relaxation into his trapezius as well as the levator scapulae muscle. So basically, you can see the crowd, that is student crowd, is basically suffering from the trapezitis. So if we can use this technique, so it will be beneficial for the patient to get relaxation from the trapezitis. Step 7 is for the entire body. So the entire body is in the relaxed position, in the supine position. Tell the patient to breathe in and hold the breath for some time. After that, tell the patient to exhale. So during the exhalation, all the stress will be released from the body, and tell the patient to repeat it for 5 to 6 minutes so that patient can feel a relaxation after completion of that particular treatment. So step 8, it is for the lower back. So tell the patient to press the thigh and ankle joint downwards so that he can feel the tightness in the posterior aspect, that is gastrocnemius soleus muscle. Eventually, after some period of time, tell the patient to relax eventually, and exhale the breath so that patient can feel the relaxation in the posterior muscles of their body. So these are all the 8 steps which we have to follow for the relaxation purpose, which comes under the progressive relaxation technique. So we will revise quickly. So step first, it is for fist. Step 2, it is for elbow, that is for the biceps muscle. Step 3 is for forehead. Basically, the forehead muscles as well as the facial muscles will be relaxed in this method. Step 4, it is for jaw. So basically, when we cleanse the teeth so that we can feel the relaxation in the jaw muscles. Step 5 is for neck. The extensors of neck will be relaxed in this position. Step 6 for the shoulder, so that the trapezius, levator scapulae will get relaxed. Step 7 for the entire body, so that the patient can feel the oozing out of the stress from the body while during the inhalation and exhalation. Step 8, it is for lower body, for the posterior muscles, for like gastrocnemius and soleus. So next technique is autogenic relaxation technique and meditation. So basically, autogenic technique, it is a self-management technique. So basically, it comes from the 4 phases. So session 1, session 2, session 3, and session 4. In which session first is mostly focuses on the phases of heaviness. Second phase is mostly restricted to the warm phase. Third phase is uses the phrase my breathing is calm, and fourth phase is basically used for the forehead and as well as for the facial muscles. So there are six standard exercises also which we perform in the autogenic technique. So first standard exercises mostly focuses on the theme of heaviness. Second exercise is focused on the peripheral vasodilation, that means the physical activities will get improved. Third exercise focuses on the normalizing the cardiac activity, because the cardiac factor or cardiological diseases, there is a high prevalence of developing the cardiovascular diseases. Fourth exercises focuses on the respiratory system to improve the breathing capacity, to improve the chest breathing as well as the abdominal breathing. Fifth exercises focuses on the abdominal area, that means for the diaphragm muscles and abdominal muscles. The last exercises, that is sixth exercise, focuses on the blood flow to the head, so that the pathway will be clear and the patient can get ease out of pain, and the patient, if the patient is having migraine, this last exercise is mostly beneficial for the patients. So we'll go to the techniques one by one. So session one, it should be restricted to the heaviness stress. So if we have to instruct the patient for the session one, so we have to tell the patient that repeat after the myself. So we'll see in the autogenic technique how our patients respond to the verbal communication or verbal stimulus. So in this session, we tell the patient that my left arm is heavy, my left leg is heavy, my right arm is heavy, my left arm is heavy, and my both the legs and arms are heavy. So these three heaviness, this phase comes under the session one, called as the restricted to heaviness phase. Session two is basically restricted to warmth phase. So similarly, what we have did in the first phase for the heaviness phase, this is the same will be written in the warmth phase, where we have to tell the patient that my left arm is warm, my right arm is warm, my left feet is warm, my right feet is warm, my both the legs and feet is warm. So these comes under the second phase. So we can see how patients react to our verbal stimulus and verbal responses, and how it will affect the patient's normal day-to-day tasks. So basically, session three is uses the phrase that my breathing is calm. So we have to tell the patient continuously to use the phrase that is my breathing is calm, my breathing is calm, so that patient can practice more on the breathing exercises. So eventually, if the patient is mastered into the breathing exercises, automatically the stress gets vanished. So these are all the meditation techniques or breathing exercises. So there are some behavioral techniques also which used to combat stress or to cope up with the stress. So first technique is biofeedback. So mostly in the neurological patients we perform biofeedback technique. So biofeedback is a common form of stress management and relaxation therapy. So biofeedback machine gives immediate and ongoing information about the biological activities, muscle tension, skin temperature, brain waves, activity, sweating, blood pressure, heart rate, and breathing. So basically, when the patient is undergoing stress, there is an increase in skin temperature, there is increase in muscle tension, there is increase in sweating, increase in blood pressure, the increase in normal heart rate. Also, the breathing is unsteady breathing. So biofeedback is a machine which gives the information about a particular components of the body, where when the patient is in stressful condition. So we can say biofeedback we can use as an outcome measure if we have to study the fibromyalgia. So what are the indications of biofeedback technique? So if the patient is having tension headache, migraine, hypertension, insomnia, muscle spasm, pain, epilepsy, anxiety, phobia, asthma, teeth grinding, see, these all conditions can be treated by biofeedback technique, and these are all associated with the in the fibromyalgia. The patient complains of this technique if the patient is having the fibromyalgia. So second one is the electromyograph. So basically EMG technique, it is used to measure the voluntary action of the skeleton muscle, which is monitored by the EMG electrode. So these electrodes, there are three electrodes which are mostly used in the EMG. So two electrodes are placed at the measurable distance, and one electrode it is placed at the bone at a reference point considered as a reference point. So the most of the muscles which are involved in the EMG training, that is frontalis muscle, mastoid, trapezius, and if we can see the prevalence of developing trigger point in the trapezius muscle is higher than the any other muscle. So these muscles typically respond to stress and are accessible to monitoring. So if you know that the patient is a fibromyalgia patient and stress is a major factor, you can use EMG as outcome measure to study all the factors and to give the particular treatment or intervention to that particular patient. So second one is thermography training. So thermography training is usually measures the tiny fluctuations in the temperature of the body. So these are basically measured by recording the temperature of finger, hands, foot temperature. And it is believed that voluntary rising skin temperature could produce an anti-stress effect. So if the patient is undergoing stress, there is an increase in the body temperature. So we have to check whether the particular intervention is effective in the patients or not, so that we can use that the thermography training as our outcome measure. So third is the galvanic skin response training, that is we can say it is a GSR. So there is a one study on fibromyalgia which uses the galvanic skin resistance as a outcome measure, and it gives a beautiful result. So under severe stress, the sweat gland in the body are activated, leading to increased secretion. So there is a more of sweat gland activities. So galvanic skin resistance basically measures the your activity of your sweat gland, that is your autonomic nervous system. So there are the electrodes which are placed at your thumb or at your index finger, and it will check your sweat gland activity by the autonomic nervous system, and it will help you to gain the control also over the autonomic nervous system. So basically, from almost all the techniques, the galvanic skin response training gives the best result as an outcome measure for the patients with fibromyalgia. Next one is EEG training. So there are four waves in the brain. So the activities of these four waves is basically measured by the EEG training. So there are the four states of brain activities, or four types we can say. So there are four waves. The first wave is alpha wave. So it is basically associated with the state of calm relaxation. Beta wave, wide awake and thinking. If the patient is undergoing stress, then the patient can think more or eat more, so that beta waves control that. Theta wave, light sleep or deep thought, and delta wave, deep sleep or unconscious state. Fifth one is heart rate training. So basically the heart rate monitor measures beats per minute and gives the feedback on how relaxation affect our heart rate. So basically the heart rate increases in the stressful conditions. So lower heart rate, it is an indication of the relaxation response. So basically it involves the two steps: identifying when and where is the tension in your body, and how to let go of this particular stress situation. Now the next and very important aspect for the manage the stress is the lifestyle management. What is the relationship between stress and eating habits? So basically, if we see, people respond to stress in a different ways. So what do we eat, that is how we are. That means if we eat healthy, then healthy we are, or if we eat very junk food, then of course there is an adverse effect on your body. So mostly, if the person is going through the stressful situation, they may smoke, they may drink alcohol, some increase or decrease their food consumption, some stop eating. So it can give the adverse effect on their health as well as on their body. So if there is a stressful situation, we mostly overeat, or if there is a more stress, there is a more weight gain. If the patient is overreacting, so it can gain a more weight. So stress is often used as an excuse for not eating properly. So if the patient is in stressful condition, we tell the patient tell, no, I don't want to eat, I don't want to sleep. So these are all conditions which are mostly if the patient is in the stressful condition. So instead of taking break, consume candy bar and potato chips. So this is the relationship of stress with the eating habits. So what makes our diet healthy? What should be included in the diet to make it very healthy? So we can eat a variety of foods. So mostly maintain your ideal body weight. Being overweight also put the stress on your body. So long-term weight maintenance depends on modifying your eating habits and on exercises. So avoid too much fat, saturated fat and cholesterol. Avoid sugar. Avoid alcohol, cigarettes, because it is high in calories and low in nutrition. As well as sugar, nothing. It doesn't provide nutritionally nothing, but it provides the calories. So take vitamin as well as mineral supplements. So when under the stress, you require more of all vitamins and minerals, especially vitamin B. So if frequent calm meals, small meal 4 to 5 times is better in a day to take a 1 to 2 large meals. So there is another factor with the lifestyle, that is sleep. So we can say sleep is a healer. So it regenerates the exercises. So it is a very important or beneficial aspect of exercises for the muscle relaxation part. So if the person is response to stress, our bodies become more tense. So exercises can help us to reduce high BP. It increases the physical strength. It helps to regulate the appetite. It improves the mental concentration. So mostly exercises not only in the stressful situation, but if we are performing exercises on daily basis, it can give the good result. Naturally, it can give the good result to the body. So adverse effect or the diseases will be thrown out of the body. So regular practicing the exercises on the regular basis will have the benefit for the muscle relaxation as well as to cope up with the stress or to remove the stress. So, for the time management purpose, if you waste your time, you are wasting your life. So, effective time management should be used minimizing the deadline anxiety, avoidance of anxiety, and job fatigue. So, there should be some suggestions or some steps to for the effective time management. So, to plan your work tasks in prior. So, complete one task at a time, then plan the other task. Give time to yourself, give time to your family, make time for yourself, go out, to attend the social gathering. So these are all the suggestions which we can do for the effective time management. So thank you for the session. Is there any questions? Hello?
Hello.
Hello? Is there any questions?
Are there any questions everyone can ask? You can put in the chat box, or else you can just raise your hand.
If you have any question, please feel free to ask. I think, ma'am, no one has responded yet for questions. So is it clear for everyone, or you have to ask anything about any strategies or any other techniques or any other doubts you can ask? No questions? Okay, thank you so much, ma'am. Thank you, Deepali, ma'am.
Yeah, there are no questions in the chat box. Right. Yeah, if there are any questions or something, you can still put on the chat box and we will try to answer you. Ma'am, we would like to ask that if there are in case of fibromyalgia patients, whenever they are having extreme pain or something, are there any specific techniques which they can use to reduce that pain-induced stress? I mean, some techniques which they can use it at the moment.
Ma'am, breathing exercises will be beneficial. Along with that breathing exercises, the technique which I have told, that the autogenic relaxation technique will be beneficial for the patient to cope up with that particular stress. So
Okay.
mostly the physiotherapists practice autogenic technique as well as the breathing exercises to cope up with that particular stress.
Okay.
And also with that, they can use the electrotherapy modality like EEG, biofeedback also technique. But mostly the manual techniques or breathing exercises will be more beneficial rather than the any other type of exercises.
Okay.
Meditation also you can say.
Correct. How about TENS, ma'am?
Sorry, ma'am?
TENS therapy?
TENS therapy will be beneficial, but actually in the fibromyalgia, ma'am, there is a more than minimum of 11 and maximum of 18 trigger points. So basically, the patient complains of pain in the overall body. So if we can give the other technique, that will be more beneficial rather than giving pains. So
Okay.
in the article or research says that if you are practicing these autogenic meditation or progressive relaxation technique, will give the beneficial result as compared to the electrotherapy modalities.
Okay. All right. Dr. Ketki, are you there?
Yes.
Yeah, ma'am will go ahead and I'll just forward it to Dr. Ketki for the vote of thanks.
Yes, yes.
Okay, thank you, Dr. Jaya. Thank you so much, Dr. Maithili Deshpande, for an excellent session on stress management in fibromyalgia patients. Your insights were practical, eye-opening, and will surely help us as physiotherapists in our patient care. We truly appreciate your time and expertise. Thank you once again. I
Thank
would
you so
extend my deepest gratitude to Ruchi ma'am for trusting us always, Pooja ma'am and Suvarna ma'am for believing in us, and thankful to the entire state team, Dr. Snehal, Dr. Uttara, Dr. Nirali, Dr. Priya for their support at all the times. Last but not the least, thank you to all the physios who have attended this session today. Thank you very much.
Thank you so much, ma'am.
There is a W World Physiotherapy Conference next year happening. So we have shared the details in the chat box. Also, we'll share all the details in the WhatsApp group also. So we are requested everybody to join the World Physiotherapy Conference. It is going to be international. So it is a great opportunity for all the physios to learn and to connect with each other. So we are sharing all the details and also the forms and everything in the chat box, also in the group. So please join. Yeah, thank you so much everybody for joining.
Thank you,
Thane
ma'am.
team is very thankful to all of you. Thank you, Dr. Maithili.
Thank you, ma'am. Thank you so much. Thank you, Deepali, ma'am. Thank you, Kirti, ma'am.